Good afternoon. My name is Dr. Tara Karamlou. I'm going to be talking today about Marfan syndrome, optimizing evaluation and the predictive utility in pediatric Marfan syndrome, novel longitudinal metrics to track growth of aortic structures. The objectives are to evaluate commonly utilized image-based surveillance metrics in a large population of pediatric patients with Marfan syndrome, which we defined as less than or equal to 26 years. Secondly, we wanted to define the utility of aortic cross-sectional area to height, or the CSA over height index, as a potential novel risk stratification and surgical triage tool in pediatric Marfan syndrome. The study population is detailed in this table. 44% of our patients were female, and the overwhelming majority were Caucasian. 91% had a typical fibrillin gene mutation, and the average age of presentation was 9.5 years. Baseline CSA over height was 3.9 plus or minus 1.5. And importantly, the overwhelming majority had non-cardiac features as their presenting symptom rather than any cardiovascular symptomatology. These plots are somewhat complicated, but I'll explain them. The three different colored lines represent growth trajectories of the patient population stratified by aortic root area, or CSA over height index in red, aortic root raw diameter in green, and the aortic root diameter Z-score in blue, since the time of presentation up to the follow-up, which was about 10 years. As you note, both the CSA over height index as well as the raw diameter tracked quite nicely with age and were quite sensitive to the growing pediatric patient population. The Z-score, which ranged from 2.3 to 2.8, did not track as well with the years of presentation. So over time, the Z-score did not correlate as well with raw diameters as did the CSA over height index. The reasons why might be seen in these stratified plots with smoothing splines. If you note, both raw root diameter and cross-sectional area over height tracked quite nicely with age of patients versus the root diameter Z-score, which was essentially not correlated or associated with patient age, which could be a problem in pediatric patients. Our patient population at the Cleveland Clinic underwent surgery for Marfan syndrome-related aortic issues at a CSA over height index of 6 to between 8, as you can see here in the yellow lines. After surgery, the CSA over height stabilized and was fairly constant thereafter. Therefore, the CSA over height index may be a more sensitive tool at tracking aortic growth in children compared to aortic root Z-score, which is commonly utilized. Pediatric patients undergoing surgery at Cleveland Clinic had a CSA over height index that ranged between 6 and 8 centimeters squared per meters at the time of surgery, suggesting that this may be an important threshold for surgical intervention. Thank you on behalf of my co-authors at the Cleveland Clinic.